Good morning, Montana Nurses Association. This is Vicky Byrd. I'm the CEO, and I'm going to give you a quick legislative update. Our state workforce advocacy team, we call it the SWAT team, has been super active and doing so well. It's making a huge impact at the legislature. If anybody's interested in that, please email the office and let us know you'd like to be on that team. It doesn't mandatorily, need that you participate, but you're going to get all the emails, all the updates. You're going to get all the talking points that you need to maybe reach out to lawmakers that are maybe passing laws that are detrimental to nurses, the nursing practice, our patients, public health, all of that. But with that said, one of our Senate Bill 140 was a right to work bill that specifically targeted nurses. And fortunately, it is tabled right now in committee. We hope that there will not be a blast motion to move that further, but hopefully it remains effectively dead. The next right to work was a House Bill 216. This right to work bill targeted public employees, and we came in opposition of that, of course, along with many of the other unions across the state, all of them actually. And we haven't got a notice yet if that bill has been either tabled or passed or amended, etc. So we'll be keeping an eye on that. Of big importance was a House Bill 303 that I testified on yesterday morning. And this bill was talking about the right of conscience. And the biggest issue with that is we already have protections in place for the nurse and the patient through our code of ethics, and we have for many years. Many facilities have an ethics department. So if there is something that is well established, heartache or moral and ethical grounds that a nurse can't participate in a certain procedure, we've already had that taken care of eternally. And the exercise of or the right to conscious objections cannot be blanket refusals. They can't result in discrimination or, result in unsafe patient care. And this bill, unfortunately, was super broad. It allowed anybody that was employed by a healthcare entity to discriminate or refuse service to any person that maybe doesn't align with their own beliefs and their own morality. And so it just was not, it is not well put together. It was not well defended. And like I said, through our code of ethics, thankfully, and through even medicine, they have their own medical code of ethics. We have those taken care of. And I know even in my own experience in our facility, there was, a nurse that couldn't participate in a certain procedure. So she would do the other procedures or do the other things there, but it was well established. It wasn't just discriminatory on how they feel, and it wasn't everyone. Where this bill could be the lady that checks you in, or the tech that takes you back, or the lab person, or the nurse, or the doctor, or the pharmacist. It goes through all of them. So it was a poorly written bill. We came in opposition, as did the Hospital Association and the Medical Association, among many others. So we'll continue to keep you updated, and please join our SWAT team. Email Ty, THAI, at mtnurses.org, and he'll get you on the team. And that way you'll be able to get regular email updates and any actions that we may need to beat down some of these bad bills. So thanks for listening, and we'll see you next week.